The OCDPA, and it is a pleasure to welcome you here this morning. We're joined this morning by over 100 registrants from across the province, including those from public health, community health, not-for-profits, health associations, and of course our own OCDPA members. OCDPA is the collective voice on chronic disease prevention, and we represent about 22 leading health-related non-governmental organizations that work together on chronic disease prevention and healthy living in a comprehensive manner. We were established in 2003, and since then we've been active in supporting advocacy and proposals affecting chronic disease prevention in Ontario, acting as networking platform and an advisory table for chronic disease prevention across the province, and for providing input on a wide variety of documents and publications. We've got four primary areas that we're working on right now, and those include to increase the degree of influence that OCDP has amongst its provincial stakeholders, to increase a sense of engagement, ownership, and benefit to our partners and our members, and to identify new opportunities for collaboration action between the members, and of course to continue to advocate for and influence the increase the percentage of funding and resources that are available in Ontario for chronic disease prevention. Our success over the past 10 years has only fueled our desire to continue to act as a champion for a comprehensive chronic disease prevention system for Ontario. And with several new initiatives, such as the release of our newly revised OCDPA newsletter called Dialogue, and our Preventing Chronic Disease Prevention in Ontario panel discussion series, we are consistently seeking new ways to promote chronic disease prevention, collaborate on and support promising practices in the field, and assist in developing tools and policies in order to improve the health of all Ontarians. And this morning, there are a number of ways in which people are participating. And so we've got live in person. We have an audience here at Cancer Care Society offices, and so thank you so much for providing a venue for us. We also have live streaming, and this allows participants to watch and to listen to the panel in real time via the computer. And just for those of you who are attempting to participate in live streaming, I just want to remind you that it does require a flash player. And if you have any questions at all throughout the panel, please feel free to make a comment using Twitter, and we'll make sure to get back to you and to make note of those questions. And if at any point live streaming stalls, please connect with Adobe Connect and the teleconference line. We also are trying to use social media in terms of Twitter and engaging folks to ask questions, to comment, and so we have a hashtag which you'll see up posted and around, and so you can use that throughout the panel. And that can be used by people who are live streaming, people who are joining by Adobe, and for those of you in the room as well. And then, of course, we have Adobe Connect, in which participants can use that chat feature at designated points during the presentation for question and for comments. And you can also use Twitter. And just a reminder that if you're trying to use Adobe, there is no audio. And so you need to connect through the teleconference line in order to hear the panel. And again, if at any point in time you have a problem with the audio or the visual, please connect through the live stream, through Ustream. And then, of course, we've got our teleconference lines. And just to keep the dialogue moving, we were going to mute those of you who are on the phone, and at certain points in time when we're opening it up for questions and for comments, we will certainly unmute the lines and give you an opportunity to ask some questions and participate. But during the presentations themselves, the lines will be muted. And just also for all of us, regardless of how we're participating, I do just encourage a sense of patience. We've got a lot of technology here, and inevitably, despite how much we prepare, things can go wrong. So if at any point it does happen, be patient, and we will try and rectify the situation as quickly as we possibly can. Just wanted to give you a little bit of a background about our discussion series, and recognize that our inaugural event, this is the fourth in our series, our inaugural event took place in October, and it looked at mental health. And then we've also looked at issues related to high-risk alcohol consumption, and we did that in November. And then we looked at tobacco control initiatives in January. And we're hoping throughout the course of this discussion series, as we build on each one, that we can look at, in essence, what are we needing to do around the various risk factors related to chronic disease prevention individually and also collectively, and we take a look at what do we need at a system. Our next session is the 5th in our series, and that's next month. It's in May, 1st of May. Early May, and that's going to be looking at active living and physical activity. And each panel discussion aims to initiate and stimulate discussion on some questions that Lynn, who's our facilitator this morning, will go over in just a few moments. And the focus is really to explore what action is currently underway and what still needs to happen in order to adequately and effectively address these key chronic disease risk factors. And then the information that we gather, the conversations and the dialogues are going to form a large provincial event that we're going to host in the fall, looking at preventing chronic disease prevention in Ontario. What will it take? And so please watch out for more details as the plans unfold for that event in the fall. And I want to pause and thank our co-hosts for this session. Our co-hosts for this session are the Dietitians of Canada and the Nutrition Resource Centre, and they've worked very diligently to pull the panel together and to make this morning happen. So thank you so much for all your efforts to do that. Before I turn it over to Lynn, who's going to facilitate this morning's discussion, I just want to draw your attention to a couple of the publications that OCDPA has worked on over the years. The first one I just want to point out is called Thinking Like a System, and it was published in 2006. And although Ontario has a number of important and valuable population health assets, coordination and integration are really needed to optimize their effectiveness. And what we did in that document is we set out a proposed plan and model for a provincial-wide system that enables effective coordinated planning, delivery, and continuous improvement of health promotion and chronic disease prevention interventions at a population level. And that's available on our website, and I do encourage you to check it out. The other document that you might be interested in taking a look at is Toolkits to Healthier Communities, Influencing Healthy Public Policies, and that was released in 2011. And that's intended for anyone who wants to advocate healthy policy in their community or encourage change at the local level. And it really walks through a step-by-step process with some practical worksheets and practical tips. So again, I do encourage you to check out our OCDPA website. We've got lots of other information up there that would be valuable as well. And I think that's all that I need to do. I'm going to turn it over to Lynn Roblin, who is facilitating the discussion for you this morning, and she's with the Dietitians of Canada. So, Lynn.
Thank you very much, Barbara, for introducing our session today. I'm Lynn Roblin. I'm here as a registered dietitian representing Dietitians of Canada. I'm also chair of the Ontario Collaborative Group for Healthy Eating and Physical Activity and co-chair of the Ontario Food and Nutrition Strategy Design Team. So I'm wearing several hats today, and it's quite appropriate that we bring all of those factors together for our discussion today about nutrition preventing chronic disease in Ontario, nutrition action required for a change, because all of the activities that I've been involved in the last many years, 3 in particular, have involved the need for some more nutrition action to happen at the provincial level. So this is a very exciting panel this morning. We are going to hear from an excellent panel of presenters, all addressing this issue, and we'd like to have some very fruitful discussion after each of our panel members present to discuss just that, some action that's going to happen. So I'm going to present just some background information on the food and nutrition strategy and the Healthy Kids panel. One of the things that we wanted to look at was what potential actions can come out of those key documents that will impact government change. And the panel presentation will happen, hopefully our panelists will be probably speaking till about 11:15, and then we'll have an open discussion on that we encourage everyone who's on the phone and in the room and out there in Twitter land or wherever they are to participate in our panel discussion. So really the bottom line is what we'd really like to do is stop reinventing the wheel and start working together. And so this is a really exciting way to put together this panel to discuss a focus on chronic disease prevention with a focus on nutrition and healthy eating. Oops. There we go. So it's a very simple agenda. We're going to have our speakers come up and do about 10 minutes of presenting each. We're going to have a small Q&A session where if you have any questions directed for the speakers, we'll have a chance to answer those. And then we'll have our facilitated discussion. So I'm going to, during our facilitated discussion, you're going to see these 3 key questions again. So I won't go into a lot of detail on these, but ultimately we'd like to address what we can do in terms of actions in the next 1 to 2 years to that focus on government, that OCDPA perhaps can help with and advocate with, what some of the research requirements and priorities might be, and what our individual organizations can be, how they can be involved. And certainly we have lots of groups represented today with the Canadian Cancer Society, with Heart and Stroke, and Canadian Diabetes has been involved in the food and nutrition strategy, and many other folks, Cancer Care Ontario, for example. Other folks have been very involved in this initiative, as well as the panelists that are going to be speaking today. So there's lots of things that we can address in terms of how we can involve ourselves. Some of the other things that we'd like to address are what is some of those major challenges or barriers that will impede these actions and what we can do to overcome those. So that will be happening in our facilitated discussion. So I'd like to introduce all our panelists at the beginning so we can have sort of a nice flow through as our speakers will come up and present their piece. So I'll just do a very brief introduction right now of our panelists. So our first panelist is Heather Manson, and she's representing Public Health Ontario. She's currently Chief of Health Promotion and Chronic Disease and Injury Prevention, and she's very involved in providing a lead on their scientific and technical areas that are related to the Ontario Public Health Standards. Catherine Ma is here representing she is a scientist at the Centre for Addiction and Mental Health and also the head of food policy research initiatives at the Ontario Tobacco Research Unit. And she's here also representing the University of Toronto, where she works in public health policy at the Dalla Lana School of Public Health. Siu Mee Cheng is here. She's the Executive Director of OPHA and also looking after the Nutrition Resource Center initiatives at the present time. And so she's involved in advocacy efforts related to public health and capacity building and knowledge transfer and exchange initiatives within the province. Representing public health nutritionists, the Ontario Society of Nutritionists in Public Health is Amy MacDonald, and she's here from the Huron County Health Unit. She's been very involved with a lot of their initiatives related to their work on provincial initiatives such as the food and nutrition strategy, as well as things related to child health and school health and many other initiatives that she will outline in her presentation. And then we're also very fortunate to have Carol Dombrow representing the Heart and Stroke Foundation. Carol's been involved with the Health Check program and also the government liaison with Health Canada regarding nutrition issues. So there's our panel for today, and we will hear from each panel member for about 10 minutes. And I've asked each of the panelists to consider in their presentations what they perceive as the key and emerging healthy eating issues in Ontario, and also to address the Ontario Food and Nutrition Strategy and the Healthy Kids panel, and whether they feel that they can help resolve any of the current healthy eating issues or concerns, or were there any major recommendations or actions missed. And if we don't cover that in our panel presentation, we certainly hope to cover that in our facilitated discussion. So each panel member will have their own presentation. Hopefully they'll be able to pick up on some of those issues as well. And so I am just to sort of frame the day, just going to give a brief background on the food and nutrition strategy. I could talk about it for probably an hour, but I'm going to talk to it in about 5 minutes, and then I'll also highlight the Healthy Kids Panel recommendations, which came out 2 weeks ago on March 4th, 2 Mondays ago to be exact. So the Ontario Food and Nutrition Strategy has been in the works for about 3 years. It was initiated by the Ontario Collaborative Group for Healthy Eating and Physical Activity. We created a design team with about 20 members who have been working diligently on it for, I'd say, the last 2 years. And so it is very much a collaborative effort. And I have a slide which shows all of the players. It is very much a cross-government, multi-stakeholder coordinated approach to food policy development. And I'm very pleased to say that we actually had an interministerial government meeting February 4th to introduce the food and nutrition strategy to a multidisciplinary group of collaborative group members, as well as government representatives from 10 different ministries. So this is the first time we actually had the Ministry of Environment in the same room as the Ministry of Health and Long-Term Care, and other ministries such as Education, Child and Youth Services, Community and Social Services, etc., all learning about the food and nutrition strategy and how they are all playing a part and how they are all connected. So that was very exciting to have that meeting happen. So that was one of our key goals, to actually have that come together. So now we are continuing our discussions with that group as well. So the food and nutrition strategy is different from the Healthy Kids Panel because it is a plan for healthy food and farming. So what you'll see in the food and nutrition strategy is a much more comprehensive approach to food and nutrition, whereas the Healthy Kids Panel is really focused in on health and growth of children and reducing childhood obesity. So just keep that in mind. The idea or the mission with the food and nutrition strategy is that it is cross-sectoral. It is promoting and supporting healthy Ontarians and a diverse and healthy and resilient food system. So again, it's focused in on the food system, not just the health of citizens. The vision is a productive, equitable, sustainable food system that supports the health and well-being of all Ontarians. Now, we do have a logic model. I didn't bring it today, but I think if you go to the Sustain Ontario website, and I do have a link on our slides that you will see later, you will see the full document with the logic model, which really explains the vision and the potential outcomes of the food and nutrition strategy. So we have 3 goals, and they're very focused in, the first one is very focused on promoting health and healthy eating and access to healthy foods. The second one is to reduce chronic disease and obesity. And the third one is looking at strengthening economy through our diverse and healthy and resilient food systems. Now, I'm not going to go into each and every one of our recommendations because the Ontario Food and Nutrition Strategy lists 24 key priority areas, and so they're under 3 strategic directions. So under the first strategic direction, we're looking at access to food. So all Ontarians have access to healthy and the means to obtain healthy, safe, local, and culturally accepted foods. So under this, there are 5 key priority areas, and this is where we're looking at household food security. We're looking at safe and healthy foods, especially for vulnerable populations. We're looking at the promotion of healthy foods and beverages and integrating food policy into land use and community planning. Our second strategic direction is Ontarians have the information, knowledge, and skills and relationships to support healthy eating and make healthy food choices where they live, learn, work, and play. So this is where we talk about increasing public knowledge of what healthy eating really means. We talk about having resources that support Ontarians no matter what age or stage they are, whether it's breastfeeding or seniors, to learn how to eat well. Whether they're in schools or whether in community centers, that they should have access to healthy foods and the resources to do that. This is where we talk about food labeling, that there's information to help consumers make informed choices. We do have a strategic initiative under protecting children from targeted advertising and marketing to foods. And you will note that if you looked at the Healthy Kids Panel report, it says for children under 12, and our report says under 13. And there's various, different organizations where what the magic age is, we're not really, all on the same number, but I think the intent is the same, that children who aren't old enough to make decisions should be protected. And the third strategic direction is really addressing the food system issues. So Ontario has a diverse, healthy, resilient food production system that contributes to an equitable and prosperous economy. So I'm not going to go into all of these because they are quite different than the Healthy Kids Panel. So this is where most of our recommendations are, and this is where a lot of important liaisons need to be made between the Ministry of Agriculture and Food, Rural Affairs, Ministry of Environment, Ministry of Natural Resources. And when we were doing these particular initiatives, we felt that we didn't know a lot about what was happening in the other ministries, and this is where it's important to start talking to the ministries. For example, the Ministry of Environment and the Ministry of Natural Resources work together, but not always. And a lot of their rules and regulations affect what happens to the food system, particularly related to water and waste and things like that. So I'm not going to go into detail about these. There's 14 recommendations related to the food system. So in terms of what the food and nutrition strategy is asking for at this point, and this is what we presented to the ministry at our interministerial meeting, is there needs to be a coordinated provincial mechanism and an advisory council to address the complex food system, cross-government and multi-stakeholder. And the food system, it is intersecting in a big way, as you know, with the health system. And so it's the big system we're talking about. We're also asking for ongoing monitoring, measurement, analysis, and dissemination of some key health, social, economic, environmental, and food supply indicators. One of the obvious outcomes would be policy, legislation, regulation, and programming related to promoting healthy food systems. Another key support is capacity and resources to support all elements of the strategy. And this is the point where I make a big pitch, because the 20 plus members of our design team have all been working off the side of our desks through our own organizations on this strategy. And right now this strategy is not funded. We don't have government funding for it. We would love to have an infrastructure in place to have it supported in a more substantial way. So that's one of the things that we're asking for at this point, and that could be a key action that we could discuss today as well, that if we want this strategy to continue, we need to have some structures put in place and some financial support for it. The other thing that we're really asking for is clear, timely communication at all levels. So when decisions are made at the government level, it's almost too late for us to, like, the Local Food Act is a very good example. I think that act was pulled together in about 2 months, and fortunately they went to the right people. Sustain Ontario was involved, the collaborative group was involved. We had an opportunity to provide some background papers, and they really did listen to the go-to people, because the staff themselves didn't have all of the information they needed to pull together the policy. So it's really about us being in the right place at the right time, and we need to have that clear, effective communication in order to make that happen. So this is just a quick picture of who's been involved with the food and nutrition design strategy to date. There's about 20 key players representing various academic institutions and a lot of the players that are here today. And you'll see a lot of farm groups as well listed in this. We have another group that we call our extra advisory committee, which is about 40 strong, that we've had 3 in-person consultation meetings with regarding the food and nutrition strategy. And we've also had 2 online consultations with over 200 feedback opportunities that we have accommodated in the draft strategy. So at this point, the strategy is a draft. We're trying to finalize the strategy and have it released in a printed form, printed online form in the next few months. So that's where we're at with the strategy. It was released in its current form in December 2012. So, and there's the link, and I won't focus in on that right now because you will be getting all the presentation slides, and you can access the documents there for the food and nutrition strategy. The Healthy Kids Strategy is a response by the Ontario government to achieve their very ambitious target of reducing childhood obesity by 20% in 5 years. So the No Time to Wait document is out online on the Ministry of Health and Long-Term Care website. We have linked it on our agenda. If you go to the website for the OCDPA, you can link right to the document and open that up right now if you like. And there are 23 recommendations in this report, and they're focused in on starting kids on the path to health. There's a lot of focus in on the early years and breastfeeding and prenatal care. There's a lot of focus, 10 recommendations relating to changing the food environment. So if you think back to the food and nutrition strategy, this was really our second area, our strategic area that we were looking at. So this is where they're looking at the banning of marketing foods to children, looking at restaurant food labeling, menu labeling, looking at food retailers and their ability to provide some services in sort of areas that food is hard to access, and really looking at the food guide supporting the sort of these initiatives. There's others related to universal school nutrition programs. I'm sure you've heard over and over again that Canada is the only GA country not to have a universal lunch program, and so this has surfaced as one of the recommendations for the Healthy Kids Strategy. And the third area of focus for the Healthy Kids panel is creating healthy communities. And so the focus here is on a social marketing campaign. Remember when I mentioned the food and nutrition strategy, we needed to have information to help consumers know what healthy eating really means. And so this has been lacking. Parents need to know what is the norm and what is expected when they need to feed their children right, and what does that look like. So a healthy eating campaign or a social marketing campaign, also with an active living component. There was an example of setting up more healthy communities for children, using schools as hubs for healthy eating and child health, healthy active living, and creating healthy eating environments for preschoolers. In terms of creating healthy communities, they're also looking at things like the poverty reduction strategy and the mental health strategy. And like the food and nutrition strategy, we also addressed the poverty reduction strategy. So again, there's some natural connections there. And also, families need timely access to healthy eating assistance, specialized obesity programs. And so in the food and nutrition strategy, similarly, we talked about having access to NutriStep, for example, to assess preschoolers. We talked about having families access to registered dietitians and even exercise physiology folks beyond just their family doctor. So in terms of the Healthy Kids Strategy, it must be a long-term thing. There was no one solution. They were talking about everything would be needed. So there's no magic bullet, like advertising for kids isn't going to fix it. And having healthy schools is going to help, but everyone needs to work together. We need to invest in child health. So again, we need some investment in health promotion and committing some money to that. And again, as we mentioned in the food and nutrition strategy, we need to use evidence, we need to monitor programs for effectiveness, and we need to ensure that they're working. So the whole accountability piece. And I've just got on the slide here all the different members of the obesity panel, of the Healthy Kids panel. And as I say, we already have the link for the presentation for the document there. So that is the quick synopsis, and I think there's a nice segue to Heather Manson is going to come up now, and she's going to continue on a similar theme to talk about the Healthy Kids panel and the strategy and other initiatives that Public Health Ontario are involved with. So welcome, Heather.
Thanks. So good morning, everyone. So I have to say I started in one direction and then I went in another direction, which maybe isn't necessarily good, but we are where we are. So I'll just go forward. Let me just...
Left and right. Just this one here.
Great,
and just point at any of the screens. Oops, should work. Nope.
It might not work while that window's open.
there's a window open.
Oh yeah, sorry.
No worries.
We'll get there.
Good. We got it?
Yeah.
Okay. So I'm just going to run through some slides, and this is really a thinking piece. I'm just going to be honest with you. It's a thinking piece. It's just to stimulate your thoughts and get your feedback, because what we're dealing with here is some very, very big strategies and concepts. So for the most part, what I tried to do was I struggled with how these came together and how we could make sense of it to inform action, okay? Because we could really almost mire ourselves in the complexity of this. And so along that line, I've just got up the little picture of the causal web for obesity, which is just, a complex web of protective and risk factors acting at individual, family, community, society levels across the whole life course. Yeah. And then a slight simplification, selected causal determinants of overweight and obesity in children and youth. And you can see that there's at the individual family level, at the community society level is in green, and then there are some biomedical risk factors. And then if we think about the environments for action relative to preventing or reducing childhood obesity, again, we think about the energy balance, food and beverage intake, physical activity, and about interventions at the individual, home, family settings, macro environmental levels, and then social norms and values. So we can identify settings or environments where interventions could take place. The food and beverage environment, the physical activity environment, healthcare workplace settings, home and community settings, childcare, preschool, school, and after-school settings, and so on and so forth. So that could be a framework for identifying effective interventions to create change in environments for improving health and reducing childhood obesity. Then as I began to think about, getting to action, because it seems to me that the flavor of this event today is all about getting to action. What's required to get to action within all of this complexity? And so I wanted to just share with you a model that we adapted in our Taking Action for Chronic Disease in Ontario, where we've got evidence, including drawing on the global evidence pool, as well as the local evidence pool, and then planning and priority setting, and then action and measurement. And of course, this is a continuous cycle, and it also requires knowledge exchange and capacity building in order to keep it active. But it seems to me that there has been a lot of evidence generation and synthesis, and there's a lot going on all the time. So to create this PowerPoint slide, I basically did a little quick Google Scholar search looking for anything cited in 2013, and it's a burgeoning, I'm looking at Catherine Ma, because Catherine, this must be your life. This is a burgeoning area of research. So, assessing the potential effectiveness of food and beverage taxes and subsidies for improving public health, a systematic review of prices, demand, and body weight outcomes. In the middle, there's the clip about Mary Labbé and Joanne Arcan's work, a survey of Canadians' attitudes towards sodium. On the left, from Sharon Kirkpatrick, fast food menus, offerings vary in nutritional quality and are consistently poor. The one in the middle I found quite interesting. It was about the STAMP program in the States, and it showed that dietary quality did not necessarily improve, although some micronutrients were a bit better. So we've got burgeoning evidence, and we need to continuously integrate this evidence. Beyond evidence, we've actually had some evidence syntheses and recommendation development and even strategy development. So I've got there at the very back is a report that Public Health Ontario put together to provide to the Ministry for the Healthy Kids Panel addressing obesity in children and youth, an evidence-based synthesis, no recommendations, simply a synthesis of the evidence. The report that we did with Cancer Care Ontario, taking action to prevent chronic disease, the Ontario Food and Nutrition Strategy, a plan for healthy eating and healthy food and farming, and then No Time to Wait, the Healthy Kids Strategy. And there are many, many more that I could put up here. So evidence synthesis, recommendation development, strategy development. And then we've got planning and priority setting at multiple levels. So there's the WHO document on the left, Curbing Childhood Obesity, the FPT framework in the middle. And then I put a question mark, because although there is a Healthy Kids Panel strategy document, and it's interesting, the HKP was asked to provide recommendations. Actually, what they've given is a strategy, which is kind of an interesting nuance to that. But yet, what is going to be the Ontario response to the HKP strategy report? It's going to be interesting, and we're going to have to see what happens. But it clearly will be, I'm sure the government is taking that report and reading it very thoroughly, synthesizing it, and perhaps looking at doing an exercise in priority setting. So I then began to think, what are the recommendations? So you've just gone through them, Lynn, in greater detail, but I wanted to then talk about the interfaces. So we've got our Healthy Kids Panel strategy, the 3 pillars: start all kids on the path to health, change the food environment, and then healthy communities. And we've got the food and nutrition strategy, and there are some similarity and there are some differences. And in my own mind, I have been struggling with what are the similarities and what are the differences, and how do they interface, and which one is bigger if we were going to think conceptually, or do they overlap? So it's a really interesting exercise, but I do think, Lynn, I agree with you that the interesting difference with the Ontario Food and Nutrition Strategy is the focus on the food system, a productive, equitable, sustainable food system that supports health and well-being of all Ontarians, and including healthy eating and access, strengthening the economy. So it's a bit broader in terms of the food system. But they are not, I think the important thing is that they're not necessarily divergent. There are overlaps and synergies, and particularly when you get actually into some of the enabling capacities. Both recommend whole of government or whole of society or intersectoral approaches. Both recommend the need for monitoring, measuring, surveillance, the use of evidence. So there are some really quite a bit of similarity when you look at how these are going to be enabled. And there are some differences. So one of the questions I had for myself is, how do we put these two things together? How do we put this together? It's very complicated. So I came up with the idea that what are the opportunities? And in particular, is the Healthy Kids Panel report actually, I'm mixing my metaphors, because I've said, does it represent a policy window? But instead of having a picture of a window, I've actually got a picture of a wedge. Is it actually a wedge into really developing a more fulsome food strategy, food system strategy, health and food system strategy? And so the thing, my thinking is maybe it is. Okay, and I'll finish up pretty quickly, and I won't get into the additional slides I've got, but I think I want to leave you with this idea. The reason I think it may be a wedge is because actually government commissioned that report. They set up the panel. Those were hand-picked individuals representing multiple sectors. They've developed a very full report that includes change the food environment. And there is a commitment there. So maybe it is a wedge to opening up a broader suite of initiatives relative to the food system in Ontario, a sustainable food system in Ontario. So that's where I kind of try to find a solution to this conundrum of these very big strategies. When I think about then the differences between them, if it is a wedge, and particularly if we focused on change the food environment, what are some of the challenges with that? Well, in my own mind, I'm thinking about the food system is very big and broad, and it's almost, are we going to call it the upstream component or the food production piece of it? The food production piece that starts at the farm or starts at the point of first production, compared to the interface with the consumer, right? So in my mind, the Healthy Kids Panel is a little bit about the interface with the consumer. So it's about, we've got production remains in essence unfettered, and instead we've got more messages, skill building, information, bans on some kinds of information, i.e. marketing bans on basically retail display, point of sale displays for sugar sweetened beverages. And then there are some incentives around for retail around putting food outlets in food deserts. But in essence, most of the action in the HKP report, changing the food environment, is at the interface with the consumer. Whereas it seems that there is a broader, almost an upstream component to the Ontario Food and Nutrition Strategy, which is about changing the food environment. I have to say that I think we can find a nice saw-off here We consider that the HKP report, if it's acted upon, actually represents a wedge issue to get into that bigger piece of business, which is critical because if we think about what's going on in the broad world around us, there is climate change. There are droughts, floods, problems with the food supply in general that need to be addressed. There are water quality issues. There are environmental issues. So we've got economic, environmental, et cetera, social justice issues. One last slide then before I turn it over to the next presenter. One way to start, one way to move to action might be to focus on the HKP Year 1 recommended milestones. It might be, okay? It might be. And these are, I just want to go through these for you in the next, just 1 or 2 more minutes. So these were established across ministerial committee. That's a recommendation as well in the Ontario Food and Nutrition Strategy. The questions would be who leads, at what level, is it cabinet, does it report to the premier, who needs to be involved, who supports, how is intersectorality achieved, is it only around childhood obesity or is there another subgroup around the food system, and how are sectors and other groups outside of government involved, and does it need a dedicated scientific advisory committee group recognizing the change in evidence. The second then is develop a detailed implementation plan. And again, my thinking is, who needs to be involved in that? I won't go through all the details on it, but, what are the suite of recommended activities? What's already underway? What's missing? Whose mandate aligns best with recommended activities and those things that are already underway or missing? Are things feasible? What are the likely impacts and outcomes? What are the costs? What's the timing? They've got to introduce the preconception health visit for women and their partners. We could get into a lot of detail on what that might look like. I'm not going to go through it for you. My thinking is in the slide deck. Introduce legislation to ban advertising to children under 12. And I think it's just cut me off for some reason. Here we go. Let's just go back. Okay. Introduce advertising and legislation to ban point-of-sale displays of sugar-sweetened beverages. And what do we know about introducing that kind of legislation for tobacco? What do we know from the Quebec experience on banning advertising to children under 12? Can we draw on those, either triangulate or draw on evidence from other jurisdictions or other risk factors? Expanding effective healthy eating and physical activity programs. What are the programs that are currently underway? Have they been evaluated? Is there a need for evaluation in Ontario? How do we scale up effective programs? How do we replicate them in other settings? What are the adaptations? Involve at least 10 communities in EPOD. And then establish indicators and reporting mechanism which clearly aligns. So I'll leave it at that, but those are just my thoughts on how these things might come together and how we might basically leverage the Healthy Kids Panel report to move forward as a wedge issue, to move forward on a more broader Ontario food and nutrition strategy. And I'll just flip through these and hand it over to the next person. There we go. Thank you.
So I have to say thank you, Heather, because I started off in a different place too, and I ended up in another place. But the place I ended up in is exactly a segue from where you ended up. So I think this will flow really nicely. So really what I was looking at in my talk is about, given the developments that have happened, what is really the role for academic researchers, or not even really academic researchers, but for research, for monitoring, for evaluation in this setting. So I love that you've specifically talked about complexity, which is really going to be the subject of what I'm going to talk about here today. So I always like to start with a little bit of history, and what I think is interesting about the time we're in now is that it's not that we've gone through a series of problems and we've come to a new set of problems or even a new set of strategies or actions. It's actually that all of the old problems haven't gone away, that we've just acquired new ones and then developed that beautiful spaghetti diagram that comes up to show kind of how complex the environment is. And the way that it's often described in terms of the issue of food advertising or marketing to children is that, we often think, oh, I was exposed to all sorts of advertising and marketing, and it's just, it's just more. But what we know is that in terms of, for example, marketing, children are exposed to a greater intensity and frequency than ever before, that there's a complex set of structures and a system around marketing and the integration with norms in our society that have changed, that is a substantive change. So I think that's what we're dealing with here when we're talking about food and nutrition issues, that there's been a substantive content change in terms of the problems at hand. But the other thing that we're seeing in terms of the recommended actions, and increasingly in the reports, and that's why it's actually very heartening, is that this issue of complexity in terms of the problems is also demanding thinking about complexity in terms of the solutions, so that it's no longer good enough to think about one intervention or even a suite of excellent interventions. It's increasingly about talking about a strategy for intervention on the whole. And so my next segue, and exactly where Heather really left off, is where you're asking the question, how do these strategies interrelate? And I think that is actually my recommendation for today, and what I want to talk about in the rest of my time, is what are the key directions for researchers in this area? So we have these suggestions for systems change, for things like integrated action. I put up other examples because, for example, in the recent UN Special Rapporteur report on the right to food about his mission to Canada, he also expressed, this idea of a national food strategy. So the idea of systems change, integrated action, different types of policy instruments, new types of policy instruments, but also the ideas around whole of government problems. And so then I've put that report, the Adelaide statement there. So we're seeing that in health and all policies, but also in things like the Alberta approach to childhood obesity as well as what's been happening in Ontario. And so in this environment, what are really the key directions or actions for researchers? And what I will say is that researchers have been very good, I think, to date, in thinking about evidence in terms of an increasingly specific description about the range of problems that we're facing. But what I see as a continuing gap for research and evaluation in this area is that there's a continuing gap in the range of population and public health research that explicitly addresses implementation and those dynamics of policy change and the dynamics of systems change, which are embedded in all of those recommendations. So if we're actually going to be able to monitor, to evaluate what we want and what we see coming out and what we will predict what we will see coming out in the long term, I think our research also has to take this brave step to actually embed explicitly a complex adaptive systems view in the research models that we create for evaluating these interventions and strategies. So, for example, so I highlight the Healthy Kids panel recommendations on using evidence, monitoring progress, ensuring accountability. And this is the image that's put up in the document. And really what they recommended was, they said that this Healthy Kids strategy needs to be a learning strategy. So it begins to tackle that idea. So, but just as everyone in this room and everyone on the line today probably has something about the strategy where they say, it could have gone a little bit further. So this is my piece of it could have gone further. In terms of the recommendations, what the Healthy Kids Panel recommendation said was that under using evidence, it was developing a surveillance system to monitor childhood weights, risk factors, and protective factors over time, supporting research on the causes of childhood overweight and obesity and effective interventions, and establishing a mechanism to monitor implementation and impact of the strategy and reporting annually on targets. But if we look on the right-hand side of this slide, what I've highlighted is some models from academic research on implementation processes, on evaluating complex strategies. So some of this really exciting work is being done by individuals in the Dalla School of Public Health, such as Blake Poland. Robert Schwartz is looking at strategy evaluation. Pato Campo's group at St. Mike's, who's also been doing work on implementing and the conditions and the context for implementing health in all policies worldwide. And what we see about these different types of approaches and recommendations is that in the research itself, it embeds that idea of complex adaptive systems, of nonlinearity, of some of the aspects that I've mentioned here, things like the fact that yes, in intersectoral action there are multiple agents, but that they may interrelate in different types and dynamic types of ways, that those relationships are definitely not hierarchical, they're also not linear, and that they're evolving. Other features, things like self-organizing actions. So the idea that actions are not always predictable, but spontaneous. So again, we've begun to talk about those issues in terms of intended and unintended consequences. But I think in terms of the research and evaluation, I think we could do more. The idea of co-evolution of systems. And so again, I harken back to what Heather was saying. What are the relationships between these strategies as we move forward? We want to be able to leverage the collective benefits of these strategies. So the research also has to ask those questions. So we can't restrict ourselves in terms of academic research into traditional ways of asking those questions as well. Another issue is working with emergence. So the idea of emergence is that people's behavior changes along with the adaptation in the systems. And again, it's this idea of a dynamic and nonlinear process. The other issues that have been raised in the literature on evaluating strategies is thinking about issues such as comprehensiveness. How do we know? How do we know we have the right suite of interventions in this mix? How do we know that our evaluation actually addresses all of the pieces and can address that comprehensiveness? The other one is attribution. So amidst this complex system, how do we attribute, or how do we determine correlation, causality, attributing particular outcomes to which sets of interventions? These are the research problems that we need to tackle in the next few years going forward. The other thing that I'll leave you with is the idea of impact. So often in many of the strategies, we talk about reporting annually to the public on effectiveness, on progress, on targets. But I think that if we take a complex adaptive systems view, we also need to rethink the way we think about impact and shared goals. So often we say that, if we can achieve our common shared goals, or if we can come up with that common set of goals, we'll know that we have impact. But what we're learning from the work on food planning and food strategies, a lot of this really interesting academic research is coming out of Europe on food strategies there, is that when diverse actors need to see themselves in a problem, sometimes they don't have shared goals, but they can actually take common actions regardless of that. So does it matter that, a food strategy, so for example, the Toronto food strategy is the picture that I have here, does it matter that it's an economic development strategy and everybody gets on board about economic development as the key outcome? Or is this a health strategy because it's housed at Toronto Public Health? Is it a matter of getting everybody on board on the health outcomes? And what we're seeing from the different evaluations of health in all policies is that not everybody, not every ministry, around the table that we're talking about, is going to adopt health as the ultimate outcome here. So we need to find ways of evaluating these strategies that accommodates for that difference in ultimate outcomes and goals. The other example that I use, I didn't mean for it to actually be that fancy. The other example that I'll raise is I've been doing a lot of work on, or thinking actually too, around menu labeling. And what's interesting to me about the case of New York City and menu labeling, and then of course the subsequent demise of the soda beverage size idea recently, is that was menu labeling, the success of menu labeling actually about a shared outcome? Was it about changing people's behavior in terms of the amount of calories they would actually take in? And yes, it was to a certain extent. But actually, I think that what was interesting and achievable, and we've seen in actually legal analyses of what happened in New York with menu labeling, is that what was palatable to more actors, including the restaurant associations, was the idea of information transparency. Because information transparency is something that's needed for effective functioning of markets. It's needed for health literacy and for food literacy and for good choices. So the idea is not necessarily to think about what we might think as our usual ways of thinking about impact and outcomes, but to perhaps pull a step back and think about those intermediate, those process aspects that might take us further in terms of getting where we want to go. So I also bring back kind of John Kingdon's model and thinking about windows and policy change. And I bring this up because in Kingdon's streams model of policy change, he said that for us to have these windows, or the wedge that you were talking about, Heather, we have to have these three streams align. And it isn't only about having the goals align or about thinking about the problems or even the idea of only political will. It's about actually having the actions align also. So perhaps if there's common actions, perhaps we can also have diverse outcomes coming from that, and that's okay. And that's something that researchers can begin to conceptualize and to measure. So 2 calls for academic researchers, and this is my last slide, are here. So the first one is what I've been talking about the whole time, which is to explicitly include the idea of complexity and complex adaptive systems into our research and evaluation going forward. But the second one is about academics actually being conveners. We often think about academics as evidence generators, but we know that actually academic researchers often have an interesting role to play in terms of convening people from different disciplines, from different sectors, from different professions. So this is the second call that I'll make in view of the first. And that's the end of my talk. Thanks.
Hi, thank you, Kathy. That was a very great presentation. And before I get started, I just want to thank Lynn. I know that some credit was given to the Nutrition Resource Center, but I really have to say, Lynn, you've really put in a lot and you really helped pull this off, so thank you. I'm the Executive Director for the Ontario Public Health Association. I'm going to spend a bit of my 10 minutes just talking about the Ontario Public Health Association. I think that would be very helpful in terms of trying to understand where my recommendations are coming from and why I'm saying what I'm going to say. So excuse me for those of you who do know what OPHA is about. So OPHA, the mission of OPHA is to provide leadership on issues affecting public's health, and to strengthen the impact of people who are active in public and community health throughout Ontario. We like to say that we're the voice of public health, and a number of reasons for that includes the fact that as part of our association, we include amongst our voices 8 other public health and community health associations. They include NSU, which is a nursing managers group, ASFIO and SciFIO, who represent the inspectors and the supervisors, inspectors, Health Promotion Ontario, the Public Health Dentistry, Arneo Shenag, the Community Health Nursing group of that, as well as the Association of Community Health Centres and the Libraries Association. As a result of that, we have been very active on a number of fronts, and we do what we do through a number of means. This includes advocacy. One of the key documents that we recently produced, entitled Strategic Directions to Address Childhood Obesity within Ontario, is a reflection of kind of our collective voices. It's a report that actually was developed by about 7 associations, including our association, but also included Arneo Shenag, HPO, the Public Health Dentistry, as well as several societies, including OSNPPH. We also provide platforms for professionals to come together, knowledge exchange and transfer. We support capacity building in the public health sector, and we also provide programs and services and put in place projects. All right, so given that background, the following I would like you to kind of keep in mind is a reflection of kind of our members and what we're seeing. This first slide is really a slide where I've tried to roll up some common themes, if you will, around what we are seeing under the association as current and emerging issues. Obviously, the issue of the role of food in relation to healthy weights in adults and children, specifically the obesity issue. We are beginning to see this issue of coherency and vision for the role of healthy eating and nutrition programming in Ontario in all settings and surroundings. And I found it actually very interesting, Kathy, that you mentioned the issue of kind of the implementation, what's happening at the ground level, because as part of the voice of public health, we like to say we represent the workforce in public health. And the things that come our way are generally very concrete, very specific, and very much about programming. And as a result of that, we've been experiencing this sense and this concern around programming in general around healthy eating and nutrition in the province. Health and food literacy has definitely been making its way into the association on a number of different issues and themes. So this issue around health and food literacy in the general population is key for us. And I think, frankly, when I look at the Healthy Kids Panel report, when I look at OFNS, that's very clear. In fact, they all seem to merge on that one key point, and I don't think there's disagreement on that issue. I think the other piece as well is around integrated approach to healthy eating, education, and competency building across the lifespan. That's something that, again, has come across the reports, and even on our own report that was presented to the panel and as well to the Ministry and Health Promotion Division. It was noted actually by the panel and by Ministry folks, this acknowledgement of the importance of this lifespan approach, even in the childhood age, kind of from preconception through to however we want to define the end of childhood. It was key and something that they acknowledged and praised our association and our partners for acknowledging in our report. So I'm coming to specific issues, and I didn't want to belabor the point. I think there's so many issues that our association members deal with, and I could probably go on and speak for an hour, but I'm sure you don't want to hear all the issues we deal with. But these are some of the key ones that certainly are on our table right now, whether it's advocacy or capacity building. The food security piece is key for us. We have a food security work group. They're very active. Things like the nutritious food basket, which I think, if we were to move up along kind of that continuum of that path, would come back to the issue of the food system and accessible and affordable healthy foods. The built environment obviously is key for us. We have an extremely active a built environment work group. They do a lot of work around land use planning. We were the only association, public health association, that sat on the provincial policy statement and really tried to make a bid for ensuring that land use planning includes a focus around public health, and that public health is at the table on planning tables. So related to all of this is the healthy built environment, so food deserts, the obesogenic environments. Certainly what was interesting, I recently attended a meeting with all the network of public health associations, and the Quebec group brought up the issue of the fact that there's this one municipality in Quebec that has put in place municipal zoning for fast foods around schools. And that, I suspect, will also be an emerging area of interest and concern, and something we might talk about in Ontario. Obviously, the issues around interest in salt, sugars, and fats. We recently, through the Nutrition Resource Centre and OPHA, did a piece around marketing towards children of unhealthy foods. Very interesting, very controversial, I think, in terms of people who were for total bans as opposed to nutrient-based bans, and all the arguments behind both of those policy positions. Labeling has also become an emerging issue. Certainly taxation is something we're keeping our eye on in terms of the nutrient-based issues. I think what's become very interesting, and maybe it has to do with these very specific issues, is the role of industry in healthy eating and nutrition. I think that there are several positions on the role of industry, and I don't think everyone agrees, whether it's the issue of marketing or taxation or labeling or et cetera. And certainly, you know, our experience in the marketing towards children was certainly eye-opening for us. So I think that is an emerging issue, and I think will become a continued area of interest. Certainly at the federal level, I've been hearing that they want to see more involvement by industry when it comes to other health promotion partners on this issue. And that's something I think provincially we need to keep our eye on, frankly. So what more is needed? And so my presentation answers those first three questions of the panel, and this is the last question about you know, having looked at the Healthy Kids panel, having looked at the Ontario Food and Nutrition Strategy, what more is needed? I tried to find or look for some of the gaps. I don't want to get too much into it, but I do want to say that with regards to what more is needed, that my responses are really a reflection of my concerns or the association's concerns about infrastructure, frankly, the enabling resources available to the province. As great as those strategies are, and they're all great in their own way, and even, you know, where they converge, there's still outstanding concerns right now about whether or not our system, our sector, the public health sector, and our various partners are at a level in which we could even implement those strategies effectively. I mean, it's interesting to, you know, hear where we go with the evaluation of strategies, frankly, because I'm sure it's going to include a focus around enabling structures that exist to support those strategies. So this first key piece is really about a better supported public health sector to support a provincial healthy eating and nutrition strategy. This morning I just came from a presentation by Jeremy Simpson from the Globe and Mail, and he's talking about what needs to be done about the healthcare system and et cetera, and he talked about how we're in this world, in this environment of fiscal constraints, and at the same time we're being asked to do more with less, and this concern about the aging and healthcare technology costs. Unfortunately, public health is caught up in this. I mean, we have not been contributing to this huge 13 or whatever 15 billion deficit, but we have been caught up in this issue, and the concern is if we as a sector, health system, grow by 2%, what does this mean if we have all these additional priorities and commitments, including a potential strategy coming down our way? So I think the concerns that still need to be addressed is this issue around the health human resources, anticipated gaps in competency and capacity issues. The information technology management piece. It was interesting, in our Nutrition Resource Centre, we asked our members, what would you like to see more around knowledge exchange and transfer? And they said, could you do more about surveillance and management systems? That's not something that the Nutrition Resource Centre is really mandated to do, nor the association, but very interesting that our members came back with that request. Certainly the funding issue, as I mentioned earlier, the coordinator systems planning and services delivery. I think that there's still more that needs to happen across the entire health continuum, from prevention through to the other end, and obviously our partners with the social services and other related services sectors. Another piece is the integrated and systems approach to capacity building around healthy eating and nutrition and programming and policy. That isn't to say that they weren't addressed in the two reports. I think the Healthy Kids panel did a really good job about stating needing to build further capacity in the healthcare settings or the rest of the entire care continuum. Certainly the food and nutrition strategy and our own reports talked about capacity building within the school settings and the social services settings, which I think was definitely kudos to both reports. I think what is also missing and came out in our report, and certainly is a reflection of our members as well as the collaborative that we engaged in with regards to addressing childhood obesity at a systemic level, is the issue of building up capacity in government across a number of ministries, not just in health or child and youth services, but ComSoc and transportation and municipal affairs and municipal and MMH. This, of course, needs to be complemented by integrated approach to building public competency in food literacy, and this, of course, came across in both reports, so that obviously is acknowledged. And certainly a key theme that everyone agrees is a requirement. So I come back to the issue of health human resourcing. The concern around the public health professionals is that there is a concern that there is going to be an anticipated gap in the future. And with this concern and the anticipated gap, given the additional strategies and priorities coming our way provincially on top of the existing commitments related to the OPHS, how is the public health sector going to deal with this issue? Can that strategy be implemented, whatever it ends up being? Can we even meet half of that ambitious goal of 20/5? I think that's a huge concern that really needs some focus and needs to be, frankly, looked at conjointly as all these other commitments come down our way. I think another piece that we certainly have experience, and certainly through our own experience with operating the Nutrition Resource Center, is the provincial rigorous programming approach to healthy eating and nutrition. So what do I mean by that? I just mean that we need a systematic, planned, consistent, and evidence-informed approach to universal healthy eating and nutrition programming and services delivery. There are so many programs out there run in different parts of the province, and I think that it's a little disjointed right now, this environment that we look at when it comes to programs and services, and there needs to be, I think, a committed provincial look at what is happening and how we approach this issue. So these are the recommendations that are a reflection of OPHA, and that's why I was very clear to Lynn when she said, how should I introduce you, NRC, OPHA? These are a reflection of OPHA and not of the Nutrition Resource Center. They certainly they're informed by the Nutrition Resource Center, and I think the intent of the recommendations, or at least the items that I've detailed here, are really a reflection of wanting to get at the heart of the issues and not. And I cringe whenever I hear of that term, low-hanging fruit, right? Low-hanging fruit that we always hear about, and this is an advocacy piece that this government seems to very much enjoy saying. I think that this is, that the issues are systemic, that they need to be looked at systemically. And if there's a balance between the low-hanging fruit and the systems issues, by all means go after it. But if we don't deal with some of these systems issues, we'll be back here in 10 years, I'm sure, dealing with this issue, but even on a greater scale. So thank you. And on to the next video.
Thank you, Siu Mee. Hi, everyone. I plan to give a bit of an overview about who we are and what we do. I'm here to speak about the Ontario Society of Nutrition Professionals in Public Health, or OSNPPH, and I know that can be a bit of a mouthful. So not everyone's aware of what we do. We really are the independent voice for registered dietitians working in public health. We advocate for food and nutrition issues and the role of registered dietitians in public health. We have about 180 members representing nearly all of the 36 health units in Ontario. And like the Ontario Food and Nutrition Strategy, we don't have any staff. We're all working off the side of our desk on a voluntary basis, either on our health unit's time or on our own, the individual dietitian's time. And through our work groups, liaisons, and individual health units, we feel that we have a really large reach across the province in terms of nutrition programming. So I'm going to talk a little bit about some of our working committees. These committees really help us to increase the efficiency of public health nutrition programs across the province, and our structure helps us to do that. We develop resources, tools, and communications to assist our members as well as our partners. The School Nutrition Work Group supports programs, curriculum, and policy implementation. Right now, for example, they are working on adapting British Columbia's SIP Smart program for use in Ontario. Our Family Health Nutrition Advisory Group supports the sharing of resources between health units to implement common messaging, campaigns, and materials. We advocate for prenatal, infant, and child health issues. One example of the works that we've done is our pediatric nutrition guidelines that is referenced in the Ontario College of Family Physicians Improving the Odds document. We also have working groups that focus on workplace, nutrition, food for recreation facilities, and even menu labeling. Our members also liaise with 16 other public health related groups and support different projects and research. Our listserv is used for networking and information and resource sharing, as well as an opportunity to recruit members for local, regional, and provincial projects. Advocacy for legislation and policy are a priority, and our members have the unique knowledge and skills which we really believe must be recognized and leveraged to address current public health nutrition priorities. Our members are already an integral part of many public health nutrition initiatives in Ontario, and I'll speak to a few of these. The new Nutrition Tools for Schools website and our new Creating a Healthy Workplace Nutrition Environment call to action are just two of the many resources that OSNPPH has developed to support improved access to quality nutrition information, as well as to address chronic disease and obesity prevention. We also continue to seek out opportunities to leverage existing evidence-based provincial programs and tools, such as NutriStep, screening tool for toddlers and preschoolers, the Community Food Advisors Food Skills programs, and the utilization of the nutritious food basket results to determine adequate income for basic necessities. OSNPPH's advocacy work focuses on improving the food environment. We do this at all levels of government. Our ongoing efforts have supported legislation for sodium reduction, the Ontario Food and Nutrition Strategy, restricting the sale and banning marketing of energy drinks to children and youth, addressing the poverty of poverty-induced food insecurity. And our members and work groups have also consulted and provided recommendations for various different provincial and federal initiatives. Next slide. To address chronic disease and public health nutrition issues, there are three key things that we feel must be addressed. We really need to reduce the blame, shame, and stigma and shift the focus from individual behavior and personal responsibility and really be cautious of weight and other biases. So to do this, we really need to highlight the importance of policy decisions and the impact of the environment on the health of the population. In health promotion, nutrition information, and education really only have limited effectiveness. System-level change is required to result in significant improvement. And there are groups trying to do this work. The Ontario Collaborative Group for Healthy Eating and Physical Activity is one example of that. The collaborative group's work towards an Ontario food and nutrition strategy is important, and as a member, OSNPPH is very supportive. Food is very complex and involves a lot more than just nutrition. The food and nutrition strategy is consistent with our focus on the need for policy change and increased capacity and support for existing evidence-based programs and initiatives. OSNPPH wants to emphasize the role of registered dietitians in all sectors, especially public health, and stress the importance of utilizing existing programs such as the Nutritious Food Basket and NutriStep. And despite the complexity of nutrition-related public health issues, with the right resources, we feel that we can implement practical solutions to support chronic disease and obesity prevention efforts. The Healthy Kids Panel report recommendations aimed at reducing childhood obesity attempted to address the complexity of obesity and the need for cross-sectoral and interministerial action at all levels of government. As Heather mentioned, there's little yet on how to implement and who needs to be involved, but hopefully moving forward there will be. During the consultation period, OSNPPH made 9 recommendations, and the panel has either directly or indirectly supported many of these priorities. So although we feel that the goal is very ambitious, we were pleased to see the support that there was, but we feel that there's 3 of our recommendations that we want to continue to highlight and reinforce. We really feel that addressing childhood obesity requires a longer-term commitment. We were pleased to see shifting the focus from behavior to more upstream approaches, and we hope to see ongoing supports for evidence-based strategies and programs with realistic expectations and timelines. OSN-PPH also discourages the use of weight and BMI indicators for this group. We really stress the need for food and nutrition indicators at the provincial accountability agreements with public health units. There's a need to support both the development of meaningful measures and incorporating measures that already exist. There was also a lot of attention on food and nutrition in the report, but little attention on the registered dietitian's role. Leveraging the expertise that OSN-PPH, our members, and other dietitians have is a huge priority. We feel strongly that dietitians in public health have the unique knowledge, skills, and expertise to design and guide evidence-based childhood obesity strategies. Government and associations and organizations should draw on us. We want to be involved. And in order to improve the work that's being done, there's a need to enhance dietitian capacity, both in the public health sector and across the health sector. There are many opportunities for government researchers and organizations to address nutrition in Ontario. Some of the examples: need for cross-ministry initiatives, adequate support for existing evidence-based programs, and as Catherine talked about, research gaps, also addressing implementation. To me, that means support for evaluation. The process as well as the outcomes, intended and unintended outcomes as well. Talk about development of appropriate indicators, trying to move away from health or weight as an indicator of health, advocating for health in all policies at all levels of government and in all organizations, and trying to strengthen and enhance partnerships and collaborations amongst NGOs, professional associations, public health, researchers, and government. We really need a comprehensive strategy that addresses some of the capacity challenges and provides the appropriate leadership. So to sort of wrap this up, the current prevalence of chronic disease and obesity and the impact on the quality of life of the population has been heavily influenced by the changes in our physical and social environment. Both the public and private sector have the responsibility to create healthier environments, and we need to work together to make this happen. So we want to find opportunities to collaborate, to send the same message to government, researchers, organizations, and industry. And this message really is consistent from OSN-PPH, from the Ontario Food and Nutrition Strategy, from the Healthy Kids panel. So you can learn more about our advocacy efforts and resources on the public side of our website, or follow us on Twitter. We've just joined. It's a new initiative for us. We also encourage both registered dietitians and any other professionals working in the nutrition field to consider attending our annual nutrition exchange. This year's conference is May 9th and 10th at the Nottawasaga Inn Resort, and there will be something for everyone, from an obesity panel, food systems research, how to create change with policy, and many more exciting topics. And the agenda and registration information are all on our website. Thank you. And I did include my contact information on the next slide, but you'll get those.
I'm going to give a slightly different perspective, maybe from the Heart and Stroke Foundation. I think it certainly coordinates with what everyone has said so far. Just to start off with, our visionary mission is healthy lives free of heart disease and stroke. Together we will make it happen. And that together is a theme that will go throughout the presentation, because that's going to be key to making something move forward. Focus in Ontario and nationally is children and youth. I think the current and emerging health issues from childhood obesity, I think we all are aware of them. That has tripled over the past 30 years. 1 in 4 Canadian children are overweight or obese. 50% of kids aren't eating enough vegetables and fruit. And almost 3/4 of families with children occasionally or almost always go without certain food because of costs. So these are all threatening our gains and moving forward in terms of child health opportunities. In terms of the Ontario Food and Nutrition Strategy Action Plan, that big yes is that Heart and Stroke Foundation is very pleased to endorse this strategy, feels it's a very fulsome, comprehensive strategy, and is pleased to be working on it. We've highlighted the strategic direction number 2 because it fits with the direction in the area that Heart and Stroke is currently working on. These are some specific recommendations to the provincial, territorial governments and school boards that Heart and Stroke Foundation has made over the last little while. And they certainly coordinate with this strategy to include programs within the school curriculum that teach students about nutrition and how to prepare healthy foods, bring back home ec. Through reallocation of existing funds, increase financial support for schools to help implement a strong health and physical education curriculum that emphasizes lifelong skills. It was interesting, there was a report in today's paper that's saying that I think only 45% of Ontario schools have a physical and health educator in their classrooms. So that's a big problem, and the kids aren't getting their 20 minutes of physical activity every day. Develop and implement food policies that provide students with easy access to healthy foods at an affordable cost while decreasing access to unhealthy foods. So looking at the Healthy Kids panel, we feel it's a great start. Certainly there's a lot of places where our recommendations and the work that Heart and Stroke is doing is very consistent with the panel recommendations. There's about 11 out of the 23 that we're currently working on, both provincially and nationally. I'll just highlight a couple of them because there's lots of them there and you're familiar with them. Certainly the work that Heart and Stroke is doing in restaurants in terms of menu labeling with the Health Check program, any restaurant that's participating, all their menu items have to include nutrition labeling at point of purchase so that people can make the decision, an educated decision before they purchase their menu items. The other area where we're doing a lot of advocacy, in fact, we have had 50, I think at least 50 meetings with MPs right across Canada, is to encourage the government to adopt a transparent, easy to understand, standard objective nutrition rating system for products in their store, that we should have one set of guidelines. So there may be different programs, but everyone should follow the same set of basic guidelines so that the consumer in the end will benefit from this. To date, certainly with the Healthy Kids panel, the only way it's going to move forward is if we all work together. Heart and Stroke has certainly contributed to this with our Spark Advocacy grants. To date, there's been 204 grants totaling over $2 million have been awarded. The grants enable community groups and champions to advocate for equal access to physical activity and healthy eating for children and youth. And the Foundation's role is to be an advocate, a catalyst, and a communicator in this area. We've listed a number of specific actions for government, health and all policy, ensuring healthy eating and physical activity initiatives as a priority for all ministries. And I think one of the big things from the nutrition strategy is that we can get everyone to work together. So we're not saying we need to bring more money to the table, we're saying we need to coordinate that money so that it's really going to make a big difference and everyone work towards the same goals. To create a national nutrition program that includes school food literacy, school garden aspects, bring home economics back, establish federal, provincial, territorial policies to reduce poverty using the National Nutrition Food Basket as a resource there. Establish policies and urban zoning bylaws to increase access to stores and other venues, develop and implement school food policies that provide students with easy access to healthy foods at an affordable cost while decreasing access to unhealthy foods, and support community venues and programs that improve food security, including community gardens and kitchens and school meal programs, etc. I think. That wasn't part of my presentation. No, my presentation got cut off a little bit. There was a couple of additional slides which aren't there. So the main action steps, and really that's for everyone, is to make children's health a priority. So be it for government, OCDPA, researchers, individual organizations, all of them, it's important. And in terms of barriers, the key barrier from our perspective is insufficient funding and support. So it's unfortunate that you can't see the last slide because it's very cute. We have a little kid with a fist up saying, together we will give every child the right to a healthy future. So going back to my first slide was that, you know what, to make something happen, we all have to work together and we have to work towards a common goal. And I certainly give credit to Lynn and to the design group for really working on this food and nutrition strategy to have a common goal, and hopefully everyone will buy into that. So thank you.
Well, thank you everyone for the very thought-provoking presentations that we've heard this morning. I think there has been a lot of common themes around the presentations, and I really liked it. It's too bad we didn't see Carol's last slide, and I did see it. It was great, so we'll make sure that that's included in the deck when we post it. But the common themes are really working together to address the emerging and current health issues. If I go through each of the speakers, it'll take me a lot of time to summarize, but basically I just really wanted to highlight on a few key things. And when we talk about opportunities, Heather talked about the wedge, and the Healthy Kids panel is an opportunity to speak to government and perhaps drill down and get some involvement there. I really like the way you spoke about the interface with the consumer, because I think that's one thing that we really haven't had, is that interface with the consumer, what the consumer needs. In terms of assistance from whether it's public health or whether it's heart and stroke or whether it's a social media campaign, whether it's in the schools and teaching their kids how to eat and prepare foods. There's lots of opportunities when we do talk about that interface with who are our consumers, whether they're the prenatal moms or the parents. So there's some opportunities there for sure in terms of speaking with the government, and we still don't know where that Healthy Kids panel recommendations are going to go. So we certainly heard a lot of support for the food and nutrition strategy as well, which is that larger system-wide approach on food that includes food and health issues. We heard about public health resourcing, both from Siu Mee and from Amy, and how we need to have those public health resources out there to support any current or new program initiatives that are going to happen. And beyond the public health resourcing, I think we heard a new idea from Siu Mee about perhaps a more coordinated approach to what some of those public health programs offered are. And I certainly think we addressed that in our food and nutrition strategy as well. The key role of dietitians in public health cannot be understated. I think they are a lot of our foot workers who are out there spreading the message, but more than spreading the message, creating the programs and having access to the consumer. And so that's a very important part of this whole process. And the whole consistent messaging and having us as the advocates, where the government hasn't decided where they're going to go with the Healthy Kids panel recommendations. We are still trying to move the continent with the food and nutrition strategy. So we're definitely the action, we're the catalysts, and we're trying to promote things to keep going. So I guess what we want to hear from everyone now is sort of where should we be really focusing on our attentions, and if we do have some specific focus of attentions, are there any potential barriers that might get in our way? And I'd kind of like to focus on the positive first, if we can, and then maybe get to some of those barriers that we might have. So unfortunately, we've only got about 20 minutes to go through our three main questions. I thought we might have a little bit more time for people in the audience, whether on the webinar or in the room or wherever they are, to ask questions to each of the panelists. But I think we're really, given the time that we have available right now, really going to have to focus on the three questions that you see on the slides right now. And that's really, if we could maybe get some comments, questions, or directives from all of you folks on where do we feel the main action steps are needed within the next 1 to 2 years. And government could be government as a whole, or government in terms of public health and some of the programming initiatives. For OCDPA, for sure, OCDPA can play an advocacy role. We are going to be having a meeting in, I guess it's the fall now, where we are actually collecting these ideas for each of the different chronic disease risk factors. So we can play a very strong role in terms of collective action, as can the Collaborative Group for Healthy Eating and Physical Activity. Research is very important, and Catherine has certainly identified a lot of gaps in the research, but I really like the way you describe the research as complex, and that we could have common or different outcomes, and they can be at many different levels. And so just because we didn't get New York didn't get to cancel, limit the size of soft drinks, maybe the whole information surrounding that whole campaign was a public information event that the public didn't realize that the serving sizes were too large. So in many ways they've already achieved some of their goals in terms of educating the public. And then we've got many individual organizations here. We'll also be taking the recommendations back to their respective groups. And again, we have these collaborative groups through OCDPA and the collaborative group to actually work together on collective action. So I am going to open up, I don't know if the phone lines are open yet. We're going to open the phone lines, but maybe we'll start with the room here to see if there's anyone who wants to address some of the key actions that we need to start looking at. Anyone want to be brave? Yes, in the back. Oh, hi.
Yeah, hi.
Mimi Law. I'm going to, if you can ask the question, I'll repeat it here.
Okay. It's not a question, it's actually a comment. Because I'm an urban planner by training, and I've been following a little bit with the active transportation groups that have been working out there. And when I think about your built environment section, I just think that there's a lot of learning from the people who are working with planners and with other officials, etc., about how they've been moving forward on their activities, because they've been quite successful. And I think that would help in looking at food deserts and things like how do you engage the private sector enterprises through policy changes. It's kind of bringing it to a micro level.
Okay, so I'm not sure how many people heard the comment on the webinar, but it was a comment regarding our planners and all of the work that they've been doing surrounding food and food deserts and the built environment. And certainly I know we have addressed a lot of that planning issues with the food and nutrition strategy document. We've actually had the professional planners, folks that actually wrote that document, invited to some of our consultation meetings. So certainly I think the built environment and the land use planning is a very integral part of this strategy. Is there anything from the phone?
So we'll be unmuting the phone line now for telephone participants to contribute.
All participants have been unmuted. You will now rejoin the conference.
So the main action steps we're looking at is for the next 1 to 2 years, where do you think we should put our focus in when we address it? Say let's start with the government. What should we be looking at first? And I know this is hard. I know Heather talked about the wedge and the Healthy Kids panel being a wedge. Is there something that we can do with that, or is there any other suggestions for where we should go?
The telephone line is now open for feedback.
Siu Mee?
What I'd like to ask the audience is, what approach should we use in order to determine or inform the main action steps we should take in the next 1 to 2 years? Are we going for the low-hanging fruit? Do we want to raise awareness? What kind of approach do we want to use in order to achieve whatever we're looking to in the next year?
Maybe I can ask a suggestion for the folks that are in the room to come up to the podium, because it's going to be hard for me to re-ask some of these questions.
Would you like your participants to be able to unmute their own lines by pressing *6? Press 1 for yes, and
Siu Mee,
2.
do you want to come up?
All participants have been muted. You will now rejoin the conference.
So I'm just inviting Siu Mee up to repeat her comment.
I just wanted to ask the audience, as part of the OCDPA group and part of this panel, is really perhaps a better question, or maybe to help get to an answer, is what is the approach we want to use in order to identify the main action steps we need to take in the next year or two? I mean, is it about addressing low-hanging fruit? Is it about raising awareness? Is it about collaboration? I mean, what kind of approach, what should we use to help guide our action steps?
Heather?
Shall I come up?
Yeah, come on up, please.
So I'll try and say what I would say is an answer to your question, Siu Mee, but also build on that if I can. So my personal recommendation is I like the idea of the HKP panel report as a wedge or as a policy window because it is there, government requested it, it's broad, it has changed the food environment. I'm pleased that you see the interface with the consumer as being an opportunity. I personally am really, of course, always bigger is better, but thinking about what is all of that upstream activity that needs to go on around the food system, but I think that the HKP panel report is a really good starting place. So in terms of how would we determine how to align our activities, I think it's trying to really reading the report and reading the Ontario Food and Nutrition Strategy and looking for the interfaces, and then saying how do we align our actions with the suggested actions. And then within that, because there are so many HKP panel recommendations, and when you actually read the fine print, each recommendation has about a dozen other recommendations embedded within it. I think then I turn to, okay, well, what did they say in year one? And so they've got the 8, but then if you really read it, it's 6, but it's really 8. So so here's what I'm going to recommend, that we carefully review the year 1 recommendations from the Healthy Kids Panel report and read them against the Ontario Food and Nutrition Strategy, looking for the value add and alignment, and think about our own mandates. So, I'm particularly, just the learning from Ontario is that real change happens at the local level. So yes, this is a provincial report, so there's a big opportunity, and some things will only be done provincially. But can we get ourselves ready for local level change? So, thinking about the first year, establish a cross-ministerial committee. To be honest with you, that's a decision at the provincial government level. And I'm going to be really interested to see how they put that together. What informs their decision making? Who needs to be part of it? How do they ensure that intersectorality? How do they bring in those other new ideas around the food system and food production, which backs up a food environment? And how do they engage with lots of broad groups? So we might put our heads towards that. Individual organizations such as OPHA might put their heads towards what would that look like? And can you give advice through you have an advocacy role to government about what would that look like? And I think also there's a structure for doing this, which is not more than just a cross-ministerial committee. There's probably work groups, because they've also talked about other milestones for the first year around preconception health visit, the 2 legislative bans, advertising, and also point-of-sale bans, and then expand effective healthy eating physical activity programs, and then involve at least 10 communities in EPOD. So in my mind, that means there's work groups. So who would be on those work groups? How could individuals participate? How could organizations participate? And similarly with establishing indicators and reporting mechanism. Okay, then beyond sort of the structure, I think also if we look at those milestones for the first year, individual health units could start to think, or groups of organizations could start to involve at least 10 communities in EPOD. Oh, that's really interesting. What are the attributes of EPOD? We've been having a conversation about this earlier today. What are the key EPOD attributes? What does that model look like? Can we begin to develop something in draft which would align with an EPOD community so that if there was an RFP, we could come forward, right? So there's action that could be taken at the local level. Similarly, expand effective healthy eating physical activity programs is another year 1 recommendation. We found out from Public Health Ontario that health units are engaged in, our survey showed that there were 455 separate initiatives that health units were engaged in with respect to healthy eating and physical activity or healthy weights across the life course and in various settings. So what are those effective models? Have they been evaluated? Can local health units, can they wrap an evaluation around an intervention that they have? For example, Sparking Life Niagara. Who do they need to partner with? What are potential sources of funding? So can they also then can we begin to do some work at the local level around identifying healthy eating and physical activity programs that could be scaled up or replicated elsewhere? So I think those would be some of the ways in my mind. Of course, it's really interesting to think about how researchers could get involved in terms of supporting, for example, design and monitoring the strategy. When I look at the elements even in the first year, there's a need for a drill down in evidence. What are the effective components of the prenatal visit? For example, I think also, Siu Mee, going back to your really important point about capacity and workforce capacity and funding, as I drill down into those year one elements, I think that there is training required. There are best practices that need to be identified. There may be some workforce elements that need to be addressed. So, for example, if there are point-of-sale display bans, is there an enforcement component to that? Who provides it? In terms of preconception health visit, who's providing it? What are the best practices? How are those disseminated? Is there a reimbursement model, for example? So, honestly, I think even if you think about not the whole of the HKP report and recommendations, but just drill into year one and look at those specifically, there's an enormous amount of work that people could be engaged in at all levels, would be my answer to the question. Thanks.
Thank you, Heather. One of the other things I wanted to mention too about the food and nutrition strategy is that there was some recommendations that we look further into some indicators work, so that whether programs are effective or not, or working or not, and the whole benchmarking some key pieces of information so that we can evaluate progress along the time. And so certainly with the Healthy Kids panel, we do want to know what weight kids are at, what their BMIs are, what fruits and vegetables they're eating, but there's a whole other list of other indicators that we could start looking at. So there's another whole piece of work that could be initiated too, that would be combined with a lot of the research that's already going on in food security and some other areas that we can continue to do some work on. And right now with the food and nutrition strategy, where it's at this point, is that work has to continue. There's a whole list of other academic players that need to be pulled in to help with that work, because it was a bit beyond where we got to with the strategy right now, but it's certainly on our design team's agenda to address that coming up. Barbara?
No,
yeah?
Is there a question? You want me to come up and read?
Sure. Yeah, there's a question from the webinar.
Okay, this question is from Pat. Is there a specific role for federal government, a role that would hinder progress provincially if there was no contribution? And then an example of federal roles that are essential include food regulation, harmonization of food standards, for example, defining healthy foods, national coordination for school programs, and agricultural strategy. There was no one specified for that question.
I can tackle that a little bit. So I think that with the reality is we do have federal legislation that we need to look at. So in terms of food and nutrition labeling, for example, in terms of food and some agricultural issues are more federal issues. I know when we talked about advertising to children, some people felt that it was more of a federal issue because advertising crosses provincial boundaries and certainly crosses from the United States to Canada, and certainly it would have a much stronger focus if it was a federal initiative. In terms of education, that's done on a provincial basis, so a lot of what we're talking about in terms of food skills and things that happen at the sort of education level will happen at the provincial level. But I know there was talk about the food and nutrition standards. We have different food and nutrition standards for every province. So again, there's been a work group at the federal level talking about standardizing or harmonizing, not standardizing, but harmonizing some of those food and nutrition criteria that are used in those school food guidelines. So it's a tough question to answer because some things are clearly more in the federal jurisdiction, and it would be great if they were, there was some more federal initiatives that we could fall back on, because certainly why is BC or Ontario focusing on some of these issues when it could be a more national focused issue. But right now, with the realities that we have right now, a lot of us are looking at things that we can do at the provincial level and doing just what we can at the provincial level given the regulations that we have to work within. Anybody else from the panel want to address that? Carol, you might have done some more work in that. Or no? Okay. Barbara's going to come and ask a question. Did you have a response to that?
I'll be quiet.
Okay, come on up.
I'm sorry, I might have misheard a bit of the question, but I guess the question of what is the role the federal government can have around healthy eating and nutrition. I would say from a kind of a much higher level around advocacy and the role that government plays in driving policy. There's quite a bit of work that, for instance, CPHA and a number of the individual provincial territorial associations are doing in terms of trying to urge the federal government to have a stronger role in health, because as we know, health is really considered a provincial territorial issue in Canada. The issue related to the Canadian Health Transfer funding that comes into play, and using federal government as perhaps a driver or a lever for driving change provincially and ensuring consistency across the provinces and territories, I think is a key role that they can have. And, tying some of that funding, perhaps hopefully incremental above the 3% that's anticipated, some of the policy and legislation pieces, whether it's banning the advertising issue or the issue related to labeling and et cetera, I think that those pieces at a very high level, that federal government could actually have a key role in driving change and tying funding in a very conditional way to enhance healthy eating and nutrition policies and initiatives at the provincial territorial level. Thanks.
Great, thanks, Siu Mee. Did you want to follow up that issue, Barb, or is it a different question? Okay.
So I'll wait.
Heather, did you want to follow that up?
No, different.
Different too. Okay, so Barb, it's going to ask a question.
I'd just like to echo Lynn's appreciation for the work of the panel. It was very insightful, and I've learned lots this morning. But I'd be interested in hearing the panel's, perspectives on what appears to be a strong emphasis on addressing nutrition issues within the early years. I'm a strong advocate for that, so I don't have an issue with it, but there was also some matters of looking at a life continuum approach, lifespan continuum. And we also in Ontario have a strong, Ontario senior strategy. There's lots of other issues. So I'm just interested in the perspective of the panel around a strong focus on the early years versus other areas in which we could also put some energy and effort.
Do any of the panel members want to respond to that question? Amy? Thank you.
For OSN-PPH, some of the things that we talk about when addressing the early years are really starting out with healthy pregnancies, starting out with supporting appropriate gestational weight gain, nutrition during pregnancy, and then fostering optimal feeding and attitudes for parents and child care providers. It's not just about the nutritional content, but also about the feeding behaviors. As well as, there's different things like revising the Day Nurseries Act to have more current nutrition recommendations and physical activity recommendations, implementing other evidence-informed and evidence-based initiatives. In public health right now, we're working really hard to implement the Baby Friendly Initiative, and the Healthy Kids panel did address that as something that could happen more on a province-wide level in hospitals and other community settings as well. So I don't know if I fully covered that, but that's some examples. NutriStep, absolutely. The nutrition screening tool for preschoolers, which has been in place for the last 5 years, maybe? 5+ years.
Tool, so even before.
Mm-hmm. Utilizing that tool, utilizing the measures from it, making that a surveillance tool for us as well, and then the new NutriStep for toddlers and how that is going to look like implemented province-wide.
Heather had a comment. Is it separate, or Siu Mee, did you want to follow up that question? Okay, perfect. Come on up.
I think the association has obviously some very active work groups focused around child and youth health, and certainly we have a reproductive health work group that's provided a lot of recommendations around the preconception through to post-birth. I will say that with regards to the seniors health strategy piece, Barb, we do have an interest in that. I mean, for us, it's about keeping our eye on that issue. You know, this minister likes to say that she's she's a PhD in demography and her interest. I mean, for us, it's keeping our eye on this, because at some point in time, there needs to be almost a concurrent level of interest around child and youth health as in seniors' health. To be honest, as this age group moves up and starts getting older, at that same point in time, this very large older population is going to be put forward. I have to admit, we were a little disappointed with Dr. Samir Sinha's report on senior strategy, his recommendations. We were hoping to see more of a prevention and promotion aspect, and I think the prevention and promotion aspect was more about that role in healthcare and not really about public health or the health promotion partners and etc. And at some point, if we keep keeping our eye on the ball of this fiscally constrained era, there's going to be a need for enhanced focus around prevention, promotion, keeping seniors healthier in their communities and out of the hospitals. And who's going to play that role but us? So I think that right now, perhaps given where we are right now with the issue around childhood obesity, but at some point there's going to have to be an equal surge of interest in the seniors' health, for sure.
So, Barb, I actually feel that the focus on preconception, prenatal, and early years is essential, given what we know about risk and protective factors for childhood obesity. So I support that. For me, the factor that isn't coming out in the discussion is actually sodium content. And so last week, of course, was Sodium Awareness Week, and we know how pervasive sodium is in our food supply and processed foods and restaurant foods, fast foods, etc. But my assumption is that many of the Changing the Food Environment recommendations will actually address will address, for example, sodium as well as calorie content and fat. So I'm not so worried about it, but I think the focus is appropriate. The comment that I wanted to make is this. It again goes back to, is the Healthy Kids Panel Report a wedge for a broader food and nutrition strategy? And I really like your comment, Catherine, about you don't need to have the same outcomes if the interventions, to the extent that they overlap and that you've got common indicators of some of those pieces, that can have different outcomes which could be complementary. And in fact, the broader the outcomes are, the greater likelihood of success we may be seeing in some respects. But I wanted to say that my sense is that a wedge issue doesn't function as a wedge unless it's designed as such. So you can't necessarily think, oh, well, this is really interesting. We've got the HKP report, and there could be some interventions which are around changing the food environment. That could be a wedge to open up a broader Ontario food and nutrition strategy, which also focuses on the food system and food production. And therefore, it will automatically happen. My experience would be that it wouldn't automatically happen. And it's really important to think carefully about what is the interface and how, representing the Ontario Food and Nutrition Strategy, you actually design for that interface, design for the wedge. What are the indicators? Is it around identifying the common indicators? Is it around identifying that the Ontario Food and Nutrition Strategy is still developmental and that there's a need to continue to bring other people to the table, particularly from other sectors? So who else needs to be involved in terms of pushing it forward? So I just wanted to leave you with that thought that it's really important to think creatively about, continue to think creatively about how these two pieces come together. Where do they intersect? Where don't they intersect? And what else needs to be done to advance the Ontario Food and Nutrition Strategy?
Great. Thank you very much, Heather. I think we have one more question from the floor, and then I think we're going to have to end it because we're supposed to be off the air in 5 minutes. So we'll just take one more question from the floor.
So this is from Durham Region, and it's for any panelist. They said, we wondered if there would be any opportunities open for partnerships related to advocating for things like the ban on advertising to children, menu labeling, etc. So for any panelist.
It was Siu Mee from OPHA. So after we had hosted the Marketing Towards Children event in late February, we actually held a little post meeting after the conference with a number of the individual speakers, including Bill Jeffrey from CSPI. And he was kind of informing us that probably in about a year's time after he deals with some other key policy priority issues. He probably will come out at that group at the national level with some with a position, especially around the marketing towards children. His position, of course, is on total ban. And OPHA actually has adopted a resolution on a total ban on marketing towards children, and we'll probably follow suit here. So I think it might be helpful for those players, whether they're in public health or not in public health in other areas, if there is an interest, especially in dealing with that issue, it probably wouldn't be a bad idea to connect with the association, and certainly we have a significant interest around ensuring collaborative efforts when it comes to advocacy. So in that area, in the one particular area, that there certainly is collaboration. Certainly the association is always looking for collaboration on related and aligned policy and advocacy issues.
Great, thank you, Siu Mee. I'd also like to point out that Dietitians of Canada has a government relations area of their website, and we would welcome any feedback and support from dietitians who are interested in advocacy areas. Dietitians of Canada is a national organization, so our advocacy efforts at the provincial level we would direct through our government relations rep, and also to individual dietitians to go back to their MPs. So if there is any issues development, we do have a system for getting that message back to our local MPs through our own members. Sustain Ontario also is a great organization to provide some advocacy support, and they've been really tremendous in helping to advocate for the Ontario Food and Nutrition Strategy and the Local Food Act, and they're very well placed to do that kind of advocacy work. So again, go to the website for Sustain Ontario if you'd like to get involved in that. Provide us, there's a space for comments under the Food and Nutrition Strategy, so if you're interested in that, we would certainly welcome that. Anyway, I have to summarize in about 2 seconds, and I really want to thank Heather for her final comments, because it's not about abandoning on anything like the Food and Nutrition Strategy. Direction is still very key and very important. I think the point is that we do have an opportunity to focus in on the Healthy Kids panel recommendations, because that's where the government is interested at this point in time. So both of our working group will continue to address that issue and look at some of those possible early wins we can make. I think your suggestions of looking at the benchmarks were excellent. We are going to be summarizing some of the actions that have been identified. We've got note takers, we've got all the slides, and so we will have something coming out of today's meeting to summarize some of those key actions that were identified by our panelists. And I would really like to thank our panelists today for coming. All of the presentations were excellent in terms of pointing out some key issues within each of the areas, whether it's public health or Public Health Ontario, the Heart and Stroke, which identified some key issues for organizational levels, as well as OPHA. And so that was just wonderful to have you all here. And I'm going to have to hand it over to Barb to close, because we are going to get cut off in a few minutes. So thank you very much.
So really, I just want to repeat my thanks to the panels, and just to let people know in terms of some next steps. So all of the recording from this discussion and all of the presentations will be available online. So please, if you want to kind of think back over part of that conversation, you can do so. We are going to be releasing the next edition of our OCDPA newsletter that will be focused on the results and the sort of a nutrition focus to the newsletter. So stay tuned for that. We have our May 3rd, and which will be our fifth forum coming up, and I believe registration is open for that. It's on physical activity, so I encourage you to check it out. And then stay tuned for our fall event, where we are going to be taking a look at all of the discussions and the recommendations for moving forward at all of those levels, looking at them across the various risk factors and trying to articulate sort of some next steps that we need to be doing as a province. And also for those of you both in the room, and whether you're participating through live stream or through the webinar, we will be doing an evaluation that you will be receiving shortly. And in that evaluation, we obviously want to get a sense of how well did we do this morning. but you'll also have an opportunity to reflect on those questions that were on the PowerPoint. It's difficult to really get your thoughts out in this kind of a forum where we've got a number of different technology, we've got limited time. So we do want you to continue to think about what are some of those next steps, and please take some time to fill out that evaluation form and send it back, because we will be taking all of those results and using them to roll up and be releasing a bit of a summary highlights from this morning that will include both sort of a summary of the discussion this morning and then those other thought pieces that flow in after. So be watching the website for the release of that report as well. And again, just thank you so much for coming.